And welcome back. Now, Morning Live today, in partnership with the UNDP, is hosting a special voter education outside broadcast. And the objectives of the broadcast include raising public awareness on the importance of political participation and also citizens' rights to vote. They will also outline the role of the IEC as an independent body promoting democracy in a non-partisan way, as well as to discuss how to strengthen local government and address basic needs of communities and hold elected officials accountable. So as I indicated at the start of the show, Leanne is out in Diploid this morning. So let's cross over to her now, because so important. Just looking at my timeline this morning, Leanne, with regard to voter education. And we do tend to take a lot for granted, just looking at some of the comments coming through and some of the questions being asked. But I'm sure you'll have a look at that timeline and try to address some of those questions. But good morning to you, Leanne, and let's take it to you now.
Sakina, yes, a very, very good morning to you, and welcome to everybody as we come to you live from Diploid here. And this is just one of the very, very populated areas in South Africa. And I mean, there are, what we've been told, I've just been chatting to a couple of people around the area, and we are dealing with around about 8 different squatter camps that you'll find here in Diploid that are very overpopulated. There are approximately, they're estimating around about 500 to 600,000 people that live just in this area alone. So you can imagine what services are needed to keep the people in this area going. Well, I mean, where we are standing this morning, we're actually broadcasting from the youth centre here in Diploid. We're actually in Ward 95. That's the ward that we are in here at the moment. And I mean, this is a hive of activity this morning, Sakina. You cannot believe the amount of people that are out and about on the streets. I mean, we're right next to a clinic. That's a clinic there for everybody to come and get some health services. In fact, where we're going to be broadcasting a little bit later on, and that of course is where we're going to be doing this education broadcast. This is a vaccination centre. So at 9 o'clock, when everything is finished and we're off air, everybody's going to come in here, and that's where the vaccination drive is going to start. Well, you can see little ones on their way to school as well. So I mean, you can just see that this is buzzing. Hey, hi, nice to meet you. Hello. Yeah, well, you can see everybody is out and about on their way here. And I mean, when we talk about the services that need to be delivered to the people, I mean, this is exactly what these elections are all about. And I mean, you can just speak to people here on the ground and find out from them, I mean, are they getting those desired services? At the moment, this ward is run by the ANC. I've been told that it's a ward councillor, Kate Mpahlele, and she's on her way out, so she's not going to be the ward councillor from now, the outgoing. Obviously, there's a new candidate that will be coming in that will be representing the ANC. But today is not about the political side of everything. This is not about coming and electioneering and listening to this. This is about voter education and answering some of those questions, Sakina, that you were saying, that a lot of people are not sure what these elections are all about and thinking, you know, what is my vote going to? Is this going to choose a new president? Is this the kind of vote where I put it down on a piece of paper? What is this going to do? And the reality is this election is all about service delivery. This election is all about what affects you on a daily basis. Exactly what we're seeing here. There's a surgery that is being put here. It's the different kind of schools. It is about the refuse removal. It's about electricity. It's about water. It's about just general services that you as a South African receive. And is it good enough in your area or not? Well, those are the kind of things that you are voting for this time around. So we'll get all of that. We've got representatives from the UN. We've also got the World Health Organization that'll be here. Hopefully, we're hoping to get some representatives as well from the IEC that'll be coming and talking to us about the election readiness. And, you know, obviously, voting in a pandemic, I mean, the reality is that we are in a global pandemic. It's not a unique thing that South Africa is embarking on the elections. We've seen a lot of elections taking place around the world. But the reality is, are we going to ensure the safety safety of voters when it comes to health and when it comes to everything else as we do move into the elections. Well, I can actually see that my guest has arrived now, believe it or not. He's just arrived here, so I'm going to get my floor manager to actually usher him in. It's Owen Kalua. He is from the World Health Organization, Sakina, and he is the country representative. Owen, if you'd like to come and join me, it's lovely to have you here. Thank you so much for being our guest here on Morning Live, and welcome to our special education broadcast.
Thank you. Thanks very much. Glad to be here. Yeah.
You know, I was busy doing an introduction, just setting the scene for where we're broadcasting and seeing people on their daily activities moving. And this is really just a great snapshot of what we're dealing with when it comes to the different communities here in South Africa that are going to be voting in less than a week's time. As the World Health Organization, what role do you play in these upcoming elections?
Our main role really is to advise the government, which we work very closely with, in terms of ensuring that these processes are conducted in a safe environment, given that we have COVID. And really to strengthen the same basic non-pharmaceutical measures of social distancing, of hand sanitization, hand hygiene, of use of masks, and indeed ensuring that these processes are taking place in an environment that will be safe, like where there isn't too much crowding, where there's adequate ventilation. So the measures are the basic measures we've always talked about in terms of dealing with COVID, that also are very important to be observed during times when we're bringing people, large number of people together for voting, to make sure that there is safety, to make sure that there is safety not only for the voters, but also for the electoral staff and other stakeholders that are working within the election system.
I mean, this is obviously, as I mentioned in my introduction, we're not the first country to be holding elections during this pandemic. A lot of other countries have done this. What have you noticed the trends in these countries? I mean, a lot of people are worried about, obviously, the fourth wave that is going to be coming into South Africa. We've been told or warned at the end of November, December, around about that area. What role do elections, and if you don't hold them safely, play in perhaps springboarding a new wave in the country?
Yeah, the potential for a fourth wave is certainly there, particularly if we get a new variant. But even if we don't, if during these times we allow for a situation where COVID can spread, for example, when people come together, gatherings, etc., it can also result in upswings in terms of the number of cases that we are likely to be getting. So it's very critical at this time, particularly now that we are having a situation where transmission is not as high, as the test positivity rate has been below 2%. So this is the time where we should reinforce our measures so that we don't allow COVID upswings to come again. So it will be very important during this period of elections that we follow all those measures of social distancing, use of masks, hand hygiene, ensuring that at the venue there is proper ventilation, and so many such measures, so that we minimize the potential of upswings in cases of COVID. So I think this is the responsibility, not only for the authorities conducting the election, but each and every individual has a role and responsibility to make sure that they remain safe in the process, and in so doing, making sure that others remain safe too.
Yeah. You know, one of the big reports that came out, and I was reading it yesterday, was talking about the mental health of, well, particularly focusing in on South Africans. As the World Health Organization, obviously you weighed in on this conversation as well, saying that basically less than 10% of those that need medical assistance or any form of issue that they have, particularly with their mental health, are not getting cared for. You know, going into an election year like this, a lot of people have got so many issues that are plaguing them right now. But at the center of it all is the issue that not enough is being done to assist people when it comes to mental health and well-being. What is your views on this when we are sitting in the environment that we are right now?
I think the services of mental health are quite critical. They've always been critical, even when we are not dealing with COVID. But now with COVID, a lot of these cases or these situations have come to the fore, affecting not only those who have been affected by COVID or those that are working at the front lines of dealing with COVID, but all the other people whose loved ones have been affected. So it has impacted broader than those people who have been directly infected or dealing with COVID. So the issue of mental health, I think, is something for the coming years we have to continue to strengthen. And mental health is a key component of health, even by the definition of WHO, that health is not just a mere absence of disease or infirmity, but is a complete state of physical and mental well-being. So you are right to bring up this very important issue that we will need to focus on as we go forward. As we build back, even after COVID, we need to make sure that mental health becomes a key component of the comprehensive health services and social services that we provide.
Yeah. I mean, we're standing right now outside it's a pity we don't have too many cameras. Obviously, our majority of our cameras are set up inside. That's where the main broadcast will be coming from. But we thought we'd just give you a bit of an atmosphere of what's happening in the streets. And we are standing right next to a clinic right now. So this is where the community do come to access their health services. And, you know, that is something that obviously is very, very important to any community. And when we talk about going into local government elections, these are the things that you're wanting, is health services. You're wanting these services to be given to the people. In terms of South Africa's standing when it comes to health services to communities, how do we look? I mean, how are we faring when the World Health Organization looks on in terms of the care that we give to the citizens?
I think when you look across the African countries, we could be faring reasonably well, but that is not good enough where we are. I think we still need to do a lot in terms of delivery of services, health services and other social services at community level. I think that has to be strengthened because health really has to be delivered where people are. And all these services have to be comprehensive services because you are dealing with the same patient that can be affected by different kind of health conditions that require care. So at the community where people are, we need to have a people-centered approach to the provision of these services so that we can get to a point where not only are we addressing health, but we are addressing overall well-being, including mental well-being.
Yeah. Final closing note, obviously the World Health Organization watching on very closely the world. We're seeing some numbers that are increasing in the UK. The variant, just wait for the car to go past, and a bit of a sort of a more advanced variant of the Delta that is coming out. Are there any variants of concern at the moment that we should be on the lookout for as a country, that we should be concerned about? Because our numbers are looking very, very good at this point, and obviously we want them to carry on this way. But if we look around the world, is there anything that we should be watching for very, very closely right now?
The main variant of concern at the moment remain the ones we have already been talking about, like the Delta, the Gamma, the Beta variant. Those are some of the main variants that are there. But now, of course, there is this sublineage of the Delta variant that is being closely followed up, that is beginning to be quite prevalent in the UK. But the World Health Organization is keeping an eye on this and following up very closely. But at the moment, we are still looking at Delta as the main variant that are spread across most countries in the world.
So it's all about getting vaccinated. And as I was saying, this is a vaccination center. So as soon as we leave, people will be able to come in and get their vaccines.
I just wanted to at that point to say that vaccination is the intervention, the sure intervention that will help us get out of this problem. And I feel that it's critical that everyone who is not vaccinated this time should go and get vaccinated. But the vaccines are there. The opportunity to protect ourselves and the opportunity to ensure that people are protected is this time. So let's encourage everyone, those who are not vaccinated to get vaccinated, those that have only received one dose to go and get their second dose, that they get fully vaccinated. Those that are at most risk, the elderly with comorbidities, let's get as many people of those categories vaccinated, so that even when a fourth wave comes, we do not feel the heavy impact of it in terms of serious illness, hospitalization, and clogging of the health system. Because when that happens, it also begins to affect the entire economy through lockdowns, which become necessary.
Yeah.
So let's get vaccinated, and I want to call upon everyone to take this opportunity to get vaccinated.
Dr. Kalua, thank you very much for being with us and talking to us here on Morning Live. Dr. Owen Kalua, he is from the World Health Organization. He's the representative here in South Africa, just giving us a little bit of background as to what it's like voting in a pandemic, and of course all of the safety measures that need to be in place, and that big one, go and vaccinate. That's pretty much so the message that's coming through. All right, we take a break here on the program. We'll have more for you in the second hour here on Morning Live on our special education election program. Do stay tuned.